So you came all the way from Mumbai this morning.
Absolutely.
Okay, tell me about what is being implantologist in Mumbai nowadays. What is the main thing you put focus on?
So I understand that when we're talking about 25 years back, we were more focused on removable prosthodontics and fixed prosthodontics and cutting down pristine teeth.
Uh-huh.
But now, implant dentistry in the past 2 decades has been the globally accepted first line treatment strategy for the missing tooth. Okay. It's been a revolution in terms of techniques, biomaterials, what kind of implant system you want to use, what kind of treatment protocol you want to give to your patient, and more so, it's patient centric focused. You
Okay.
want to give the patient the best form of standard of care, compliance better, fixed prosthodontics in terms of implant as an anchorage, and we've come a really long way. And yes, talking about the soft bone. So, Indian scenario, we don't have very healthy individuals. We have suboptimal bone conditions. We have diabetes, a lot of systemic diseases, osteoporosis, women. Health conditions are not very conducive
Yeah.
to having good bone. So you have money, but you don't have the good bone. So when we are looking at placing an implant, what are we looking at for predictability and good function in terms of better longevity and life? Yes.
And how did the magnetic mallet play the role in this for you?
Here we come to the magnetic mallet.
Because
as I
that is a
said.
magnetic mallet
Yes,
podcast, huh?
absolutely. So I understand, as I told you, that we're not looking at ideal conditions. We're looking at very suboptimal bone conditions, D3, D4, softer bone. And when we talk about conventional drilling protocols, we remove as much bone which is there already. And that's something which is not very favorable.
Yeah.
So magnetic mallet is specifically the no drill protocol. Cool technology, no drill, no scar tissue, no inflammation, and very good bone implant contact. When you're talking about a control motor unit with attachments and progressive 1 mm, 1 mm, 1 mm going into the bone, getting linearity, getting a direction, and absolutely good bone implant contact. You're saving the bone. You have lateral compaction of the bone along the walls of the osteotomy, good osteocondensation, and that's what we're looking out for. Specifically, the maxillary conditions. That's one. That is softer bone conditions. Second, we have low sinus floors. So when we have low sinus floors, we are obviously looking at transcrestal sinus lift procedures where we want to lift the sinus floor. We want predictability. We want that the Schneiderian membrane has to be preserved. And we also want to have good anchorage. So magnetic mallet is something which has worked beautifully. Today, if you talk to me about being a novice and trying to do a transcrestal approach with a hammer and a mallet that was traditionally used,
Yeah.
it's so controlled. But in case of a magnetic mallet, you have so much of controlled force. You have 1 mm of sequentially going inside with the osteotomy. And obviously with the kind of sinus lift elevate kit that we have, it is a very, very predictable way of transcrestal sinus approach. Not just that. Extractions. Traumatic extractions is something which is very important because we want to preserve the bone. We want as much bone which is there to be there. So again, a nice osteotome, a nice attachment which would have a traumatic extraction, and lastly, crown removals. It is nightmarish for prosthodontists. So crown removals is also something which is so simplified with the help of a magnetic mallet. So it's a very, very, I would say, must-have tool in your clinical practice when you want to practice implantology. Yet, very important thing, I have seen that many patients have a lot of vertigo, giddiness, headache when you're talking about traumatic procedures. And that's something which I've seen that when you worked with the magnetic mallet, because of the controlled force, there is no BPVB, that is benign positional vertigo.
That's one of the
So we
main
elevate it
characteristics of the
completely.
technology.
There is so much of patient compliance with the magnetic mallet.
Okay, just buy it.
Just buy it. Yes, it's a must-have tool.
Talking about extractions, what do you see the main difference in making and better? What is the difference? The difference in expectation, your expectation when you have to do difficult extractions? Okay, before you got to start to use the magnetic mallet, and now, what did it bring you to a different level of expectation?
Absolutely. So, as we say that now extraction is about preserving the bone.
Yeah,
It's not about just tilting the entire tooth and getting it out,
preserving the bone.
preserving the bone.
That's the
So
point.
that's what magnetic mallet
Yeah.
gives you, not just about extraction, but also about immediate implant placement. So when you want to place an implant immediately post extraction, you can maneuver the bone with the magnetic mallet and get that kind of bone implant contact that you desire.
There's beautiful research that they're about to publish. It's been made in Italy, proving how when you do the extractions with the magnetic mallet, there is a 30% less of bone loss, which means for immediate placement, you have 30% more
Absolutely.
bone
Bone
placement.
implant contact, which is so crucial.
That makes a difference.
Faster bone healing,
Yeah.
early loading protocols, and especially in the anterior aesthetic zone. Because when you have the anterior aesthetic zone, the patient wants immediate replacement. Doesn't want to wait, nature to heal. So we want immediate replacement, and that's what we're looking out for.
Tell me about your very first implant you placed in your career.
Okay.
Um,
25 years back.
Wow.
That's when I began my implantology. In fact, you would be surprised to know that when I was a student and I was doing my post graduation, implantology was taking its baby steps. And that's the time when I was working on my research dissertation, and I had done a rabbit study wherein I had placed implants in rabbit femurs to check about the surface coatings on implants, because that is the time when surface coating was on a rage. It was not just about titanium, aluminum, vanadium, but it was purely about coating the surface so that we have better bone, better inducive properties of bone, and better bone implant contact.
Okay.
So that's the time when I started placing my first implants in rabbits when I was a student. And obviously after that, it came to understand that I was in the first year of my lecturership where I began my academic career. And that's when I had jitters of placing the first implant. I remember it was 25 years back.
How your first implant on human? How would you have approached that case if 25 years back you had the magnetic mallet? Same way or?
Wow. I wish I had 25 years back, then I would not have had a sleepless night.
Yeah.
One night before not the kind of protocols that you keep doing. Okay, I need a checklist of, I need good bone, I have a compliant patient, I have to take a calm pill myself, and a load of things. With the magnetic mallet 25 years back, maybe if I said that there's one thing in implantology that I would want to change is have the magnetic mallet 25 years back.
I like this.
Thank you.
And you know what? As you know, we're from Italy. In Italy, there's about 30 to 35,000 implantologists.
Okay.
In the country, and obviously we started earlier there, and the majority of the implants are placed with the magnetic dynamic technology. Now we're in India, but no, we started a few years back, but we have about 200,000 implantologists, so it's a bigger game. What is the one message you would convey to your colleagues to say, hey, there's something new here, there's something better, take a look at that?
Embracing
Just in one sentence.
one sentence. Be bold. Embrace the new technology.
What's my advantage? I'm the 200,000 dentist. What's the advantage I get?
What is the advantage that I get? Well, the advantage that probably you would have for embracing the new technology of magnetic mallet is something which is a sure shot success mantra.
Wow, good. That's a beautiful message to convey to
Thank you.
to the rental space in India. Hey, how do you see implantology changing in the next 5 years? 5, not 10, 5.
5. Okay. I see each and every implantologist having the magnetic mallet.
So that is something that would change myself too. That's
But yes, as I said, more number of implants being placed rather than removable prosthodontics, more predictability in terms of implant systems. As I'm a prosthodontist, I would say that it's not just about surgery, but it's also about occlusion and longevity. And how would you want to plan the occlusal schemes? Because once you start loading,
Mm.
that's when the action begins. So it's not just about the bone hugging the implant, but once in function, once you start chewing, that's when the implant has to hold. So that's where it's important when you have softer bone conditions. You need to have predictability of what is the technique that you're using rather than just an implant system that you're probably relying on. The technique, your skill, your knowledge,
More
diagnosis.
focus on the bone, more focus on
Yes,
on the
yes,
patient,
yes.
right?
Your mind needs to see what your eyes are going to see. So if your mind doesn't see it, your eyes are not going to see it.
Have you seen, Dr. Saloni, have you seen in these 25 years the patient's expectation changing?
Of course. Of course. The
More
patient,
challenging for you?
very. Patients are well aware because earlier we guided the patients. Now it's reverse. The patient comes to you because the patient is well aware in terms of internet, in terms of websites, in terms of AI, for that matter.
Mm-hmm.
Artificial intelligence has kind of revolutionized the way our minds are thinking. So it's just a click of a button, and like there are 1,000 replies to that one question. So the challenge is so much, wherein the patient is so well aware of the do's, the don'ts, the risks involved, and what is it that they expect from you.
That's so true because I belong to a generation that I remember now when I was a kid, we used to go to the dentist who was the family dentist, of course,
Yes, of course.
and the only word we used to say was buongiorno, good morning,
Good morning.
and then arrivederci. So you didn't dare to
Say anything.
to say anything, right? Now, when I talk to friends of mine, they're not in the dental space, just friends, and of course, they know the job I do, and we talk also. We happen to talk about dentistry. Everyone is so aware, and the expectation, of course, are much higher than what is typically possibly doing. So I understand the challenge. The challenge is okay. You started from here. I need you to take you there to make you understand that this is what you can really get, right?
Absolutely.
And then you have to deliver that, right? Otherwise, they simply go next door. That is what's happening.
So
What we
nice.
see,
Yeah. So
especially in Italy, where we, in Southern Europe, also in Central Europe, there is this dental tourism effect.
yes,
Okay,
yes, it is.
a lot of people are wrongly thinking that they can fly to another country. I got a full mouth done in 2 days for 1/3 of the cost. That's clearly not possible.
No.
Okay, but it's part of the game.
It
That's
is.
the expectation, right? So I understand that being in a position for you where you know what's going on, you know where is the gold standard nowadays, in what is possible to deliver. Being strong in that position is a way to drive the patients to understand what is the best for him or for her. Okay, so it changes a lot in 25 years.
Of course,
What you're
it's
doing.
one statement that I normally always tell myself is that fear the storm if your roots are not strong enough. And it's the same for implants. If you do not have your implants anchored properly, then trust me, you have your patient married to you for a lifetime.
And it's if I can add, complete. No, I like what you said. I like that thing, and I think we always have to be aware that we need to keep growing our roots,
Very much.
and that's something that you do every day.
Learning is a curve.
Open mind, curiosity, and also filtering, because there's a lot of things out there that they seem interesting, they just don't make sense, or that they make sense but they're not really necessary. So keeping growing roots in this industry has this challenge of picking what really makes sense. We were at the IDS in Cologne last month, at the IDIC in Dubai a couple of months ago, and when you walk in a dental show nowadays, you see, so wow, this is
Very
really
glamorous.
this big. There's so many things. What do I do?
Of
So
course.
I understand the challenge, but that is a challenge that has to be taken because, like you said, if you want, you need roots to
The
be
roots.
strong.
Strong.
Yes, okay, I know what I'm doing. And let me tell you something. Me, I'm not a dentist, but I am in the position, especially when I go in a new country, in a new market where they don't know about the magnetic mallet, the technology. Okay, and I really hope that sooner or later will come a similar technology in the market, because the more we are, the better it is, right? Telling to the entire world, hey, it's no longer like it was. So it happens to me when I go to a new market that I just don't know, and I listen to things that I used to listen maybe 15 years ago, or in India maybe 7 years ago when we started. Like there is an ankylose root. There is no way you can place the implant immediately, because we have to use the drill, remove it. It's no longer like that. You do have a solution. Or you were talking about soft bone.
Yes.
Well, soft bone is you under prepare, or you just find a way to condense. No, there is a way to deal with soft bone nowadays,
Absolutely.
or with a little bone, and I believe that for the next 20 years, a bit.
It's going to stay.
Yeah,
It's
yeah,
going to stay.
yeah, yeah.
So we need to, in fact, for the magnetic mallet, we probably need to, even make it more sophisticated, with more amount of attachments, more amount of, research, because it's going to stay.
Yeah,
It's just that you need to probably keep on, adding on, depending on the challenging clinical scenarios that every single day you say face in your clinical practice, because no one patient is going to give you a stereotype type of treatment. You're going to have someone different every single day.
yes, we are here to stay,
We're here to
and
stay.
I'm honored to have you here today, because you were one of the pioneers in India with the magnetic mallet.
Thank you,
So
Claudio.
thank you very much for
It's a
being here
pleasure.
today and having shared your experience with the magnetic mallet.
Thank you so much. It's really been a pleasure and an honor, and to continue working towards the betterment of giving every single patient what he desires.
Thank you.